Good morning, everyone. Today, I'd like to discuss Pharmacology Practical Skill Competency PH 5.1 that states communicate with the patient with empathy and ethics on all aspects of drug use. It integrates with one competency from internal medicine, and that is 12.14, that describes write and communicate to patient appropriately a prescription for thyroid based on age, sex, clinical and biochemical status. So I will be citing one example to communicate all aspects of thyroxine subsequently. The domain includes at com level is show how, core competency, and the method which I suggest would be a lecture or a group discussion on cognitive aspects of this communication, which is followed by demonstrative role play, and assessment will be on the skill station. Generally, it has to be evaluated by logbook entries. And now, as we all know, effective communication is a core competence skill for IMG and can be learned. That is very important. While communicating with a patient about all aspects of drug use, a student has to acquire skills, that is, demonstrate that he has acquired. One, effective communication has occurred, and second, he has used empathy and ethical principles during communication. Therefore, this presentation has three parts: introduction to communication skills, description of all aspects of drug use, and skill acquisition by understanding and applying ethics and empathy during communication on all aspects of drug use. And this can be followed by role. What is communication? A transmission of information, thought or feeling in a way that it is clearly received, interpreted and understood. It is an essential social activity for all of us. Speaking or listening without understanding is a failure of communication. A study shows that about 70% of the medical errors are due to poor communication, and this can be accessed also. A doctor should first understand patient needs and then in simple language should communicate the details of the drug therapy. In Harrison it is written, the ideal patient-physician relationship is based on thorough knowledge of the patient, on mutual trust, on ability to communicate. Now there are various caveats for effective communication: body language, eye contact, asking questions, voice should be in soft tone, encouragement to continue, active listening. I will focus on active listening, smiling face, and checking that communication has actually occurred. Now, overall, this includes the verbal and non-verbal communication. Effective listening steps would be: put the speaker at ease, show your interest to listening. Speaker here would be patient. Remove distractions, empathize with the speaker, be patient, hold your temper, invite questions, ask questions, and find. So now this is part 1, all aspects of the drug use which are to be communicated to the patient by IMG. Aspect 1, understanding of medicine's desirable and undesirable effects. We have to explain in vernacular language about the needs, the main effects and the main unwanted effects, so that risk-benefits ratio, what are the potential benefits and what potential harms which can be accrued during drug intake. If the number of medicine in a prescription is more than one, then each medicine should be explained in this way, so that patient has an understanding of how to take it. Emphasize the need of investigation required for monitoring the effects of the drug. Many examples can be given: TSH for levothyroxine, hemoglobin A1C for diabetic control, and ECG for cardiovascular diseases. Explain the need for injection if required. Ensure that patient is understood all well. That is. Now, aspect 2 is Medicine procurement, storage and use. How to procure, carry and store, how to open a bottle, how to load a insulin pen, how to load a canister in MDI or capsule and DPI, how to measure a liquid medicine, how to discard the leftovers, how to break open an alfoil blister cap so that it doesn't harm or prick the skin. This is very important. These aspects should. Aspect 3 is about drug intake actually. Route, how often, when, with what, at what time, how long, interval between two different medicines, when to discard the unusable medicine, what to avoid and what to take, food, effect of the food and relationship with food, if a dose is mixed or excess dose taken, what to do. All information must be given to the patient, and patient should also note that he or she has to inform if she becomes pregnant or any new illness erupts up during drug intake and medicines are not available or seem different than earlier supply, then you should inform and ensure the same supply. If allergy or new symptom appear after medicine intake, she should or he should inform, and if patient is undergoing surgery or anesthesia, he should inform the treating physician. Also instruct to note to share medicines with other patients, particularly never share to children. That is very important to avoid the toxic manifestation. We must encourage patient to narrate his or her apprehensions. Often cost restricts affordability, can lead to poor compliance. If not able to afford, then one may provide with alternative resources or alternative medicines, affordable medicines, and that will promote medicine. Now, aspect 4 is 4.1 self-monitoring by patient, temperature record for fever, blood sugar measurement for diabetic control, home blood pressure measurement for hypertension control, measurement of morning pulse rate for thyrotoxicosis, and weight measurement when patient is on beta blockers or diuretic therapy. So these simple things patient has to do and to understand. It is yet another aspect of the. Another is aspect 4.2 periodic monitoring by consultant, when to come for next visit, what therapeutic assessment will be done and dose then will be regulated or not, and when to stop medicine advice will be given. And laboratory tests which are very necessary need to be done periodically sometimes for chronic disorders such as diabetes. For example, is a long chronic infection, CBC has to be done. If there is mixed edema, thyroid function test has to be done. If patient is on warfarin, then coagulation studies must be done, and patient is anemia, ferrokinetics need to be done. So these were all aspects of the drug use. Now I will simply describe empathy and its role in. We all know it is an integral important ingredient in clinical practice and for effective communication. Empathy is the ability to understand and share the feelings of others as if they are own. It comes from the Greek word. Empathy differs from sympathy. In sympathy, IMG would listen and he will also internalize and realize the problem. Whereas in empathy, he will also create an environment to communicate with softness, with those aspects and virtues which patient will be able to get comfort. And this is the example of empathy rather than sympathy. If we sit and realize ये भीग रहा है, that is sympathy. But when you are doing something, is actually empathy. So in empathy in communication, it is the exchange of ideas or information which are based on understanding emotions and perspectives. So it is about the doctor putting himself in the patient's shoes and bringing compassion. It is an integral part of ethical communication. It is very important. Empathy is a part of ethics. Doctor has to be aware and get emotionally engaged in the feelings of patient. And this can be done by active listening. By active listening, because it conveys respect for the patient's feeling, involvement and respect. Empathic communication is critical in breaking a bad news early and honestly, and reduces chances of litigation. Actually, in ATCOM, such exercises are already there. There are many advantages to doctor and patient both by applying empathy during communication. Positive doctor-patient relationship because it establishes trust. Patient adherence to treatment enhances. It has been found that half of the medical recommendations are not followed because of absence of empathy. Actually, patient outcomes may improve because placebo effect is increased by empathy. Emotional health is improved and accuracy of diagnosis also occurs because comfortable position and openness and ability to receive patient's perspective. Patient motivation and empowerment is increased and professionalism. Empathy is a part of professionalism. It also reduces anxiety, stress, uncertainties, depression, morbidity, and may also reduce polytherapy. So, using empathy in communication has. Now, I'll also speak about ethics. You all know ethics is use of moral behavior, and moral behavior is based on values. What are values? What we believe is good or worthy, and it forms the foundation of morality. Example is, I value your opinion. Equitable justice is a value. What is a principle? A fundamental characteristic that is a standard that guides conduct is a principle, and morality is a right or wrong conduct by conscience. So that evaluation of a conduct being right or wrong by conscience is called as morality. So when we combine all these, when one values principles and morality, his conduct will be ethical. I'll repeat, when one values principles and morality, his conduct will be ethical. Ethical conduct promotes professionalism, and professionals take pride in their work. And medical ethics is a system of moral principles that apply values and judgments to the practice of clinical medicine and in scientific. Four principles of ethics we all know is autonomy, beneficence, non-maleficence, and justice. Here is an example. Four principles during communication can be applied. But before that, what are the other ethical aspects for communication? Honesty, objectivity, integrity, carefulness, and keenness, openness, respect, confidentiality, non-judgment, attitude. Therefore, ethical communication is clear, concise, truthful, and responsible. So each of these virtue plays very important role. And as told you earlier, empathy is an integral part of ethics. Ethical communications are always beneficial because effective and empathic communication is an ethical responsibility of the doctor. It fosters trust and faith, promotes compliance, promotes rational use of medicine, and reduces medication waste, ensures success of therapy. Therefore, truncated or incomplete communication leads to medication errors and harm to patient. Right of a patient should be known because we have obligation to fulfill patient's right to respectable care, right to obtain relevant, current, understandable information about health issues, right to participate in decision making, right to expect all communications records when needed, right to privacy, right to consent or dissent, and right to know hospital policies, and right to know reasonable continuity of. Now, this example will tell you how we can use or utilize the ethics principle in communication. Autonomy, right of patient to adequate information about drug or treatment to take a decision. Therefore, whether patient should take a drug is patient's own decision. But this decision will be taken when adequate drug information is available. Beneficence means our motto is to provide succour, and therefore adequate drug related information is to be given for benefit because patient must know the risk benefit ratios. Non maleficence. Hippocrates said, primum non nocere. First, do no harm. Medicine should not be worse than disease. That is very important. Therefore, sufficient information, adequate information regarding safety issues should be given. And just as we have to be non-discriminatory, and we will give all opportunities to all patients suffering from such disorders. So this way we can use communication. Now, in the end, I will also show you how all these principles can be utilized during communication as a demonstrative role. This is a case scenario. A 28 years female weighing 70 kg consulted physician because of gradual onset of weakness and slowness of the movement. She has gained 10 kg in last 3 months. Her menstruation is profuse and lasts for 4 days. Her husband has noticed that her voice has become slow, hoarse and husky. Now, on examination, conjunctiva and tongue were pale, pulse 60 per minute, blood pressure 146/78 and respiratory rate 18 per minute. Temperature was 98.0 degree Fahrenheit. So looking to this, probably this patient suffers from hypothyroidism. So tests were done and it was found that her hemoglobin is 9 gram. She has microcytic hypochromic anemia. Serum cholesterol is raised. Thyroid functions showed derangement and TSH is raised to 9 micro international units per ml, whereas T3, T4 are slightly reduced than normal. So this confirms the primary hypothyroidism due to thyroid. Now, treatment which a consultant provided is levothyroxine 25 microgram once daily in the morning on empty stomach with glass full of water. Ferrous sulfate 200 mg once a day after meals and continues medicine for 6 weeks and then report. She appeared worried and lost as to how to take these medicines. Now as an IMG, how would you communicate with patient? All aspects of thyroxine use and iron use. Now this is a communication which can be done and learned by repeated observation and repeated reviewing. Now patient looks merciful with folded hands. Doctor, do I have some serious illness? Doctor says, not at all. Underfunction of thyroid gland, which is a butterfly gland in front of your neck, is quite common in some ladies. So the attitude is reassurance, means empathic. But why does it occur? Truly speaking, in most cases, exact cause is not known. But we do know much about the disease and its treatment. So it speaks truth, observes ethics. You mean I shall be alright with these medicines? Yes. Once the amount of the thyroid hormone becomes adequate for proper functioning of organs and system, then you can lead a near normal life. It is an honest statement. This is very reassuring, doctor, but please tell me how to take these medicines to get back to normalcy. Doctor says, I will talk about tablet levothyroxine first. This medicine provides same hormone to body that your thyroid is not able to produce. The medicine must be taken on empty stomach in the morning and nothing be taken for 1 to 2 hours. This is very important as we not even milk or tea is the question. Nothing please, he emphasizes. Why so? Patient asks. Because after you have taken this medicine, the hormone in it must pass from gut into blood so that all body parts get it. If you take milk, food, protein and particularly soya products, medicine will be trapped into this stuff and will not be available for body use. So that is empathy explaining with patience. I notice that quantity of the medicine in tablet is very small. Can I take 2-3 tablets altogether for early recuperation? Never do that, because it is very slow acting medicine and your body functions will return back to normal gradually. If you do so, then you may have perspiration, uneasiness and thumping heartbeat. So it tells about the medicine in detail for proper use. So when would the dose be increased? Perhaps once in 4 to 6 weeks. You would note that 120 tablets are supplied in a bottle so that you don't have to buy too frequently. Also remember, the thyroid tablets are color coded. Your tablets are orange in color. If dose is increased to 50 microgram, then the color of tablet will be white. So it informs all aspects. It's an important aspect. Oh, that is so. Okay, doctor, can I take second tablet with it? Certainly not. It could also bind with thyroxine, making it unavailable to body. What if I miss the dose? Then take it as soon as possible and make sure that you do not miss the next dose. Smiles pleasantly also. So it is effective communication. You must take the medicine at about same time in the morning regularly, and also inform if you become pregnant. You must plan pregnancy once your thyroid hormonal levels are in normal range and not before that. This is because doses of medicine need to be regulated to ensure that the baby receives required hormone for growth and development. If you ignore this aspect, then baby's growth and brain development are likely to be adversely affected. So this is an emphasis on the potential harm as well as potential. Doctor, how do I know that my hormonal levels are normalized now? Okay, once medicine starts working, you observe changes in your body activity, reduction in body weight, and you will feel energetic. But monitoring must be done by blood tests for thyroid functions, that is T3, T4, TSH levels, periodically, maybe every 6 months. Is the truth telling? How long will I take this medicine? Perhaps lifelong, just as diabetic or high blood pressure medicines are taken lifelong. Dose shall vary. Looks worried. Then here is empathy. We must be grateful to medical advances that effective medicines are available now. Think of old days when only animal extracts were given for such disorders. Why is TSH raised and T3, T4 lowered? Your pituitary gland in brain has sent excessive hormonal signals to thyroid to manufacture more T3, T4, but in vain. The thyroid is not able to do because of disease. So it is an effective communication. Any food advice? Take food rich in iron, liver, dry beans, dry fruit, wheat germ, yeast, green vegetables, banana. But avoid cabbage and turnip. Why so? They may contain chemicals that obstruct the thyroid function. I would like to know more about the second medicine now. This medicine contains iron which is needed for formation of the blood hemoglobin by bone marrow. So it responds to queries. Is an effective communication. How shall I take this medicine? Take it alone at least 2 hours after thyroid medicine, preferably on empty stomach. But if you are unable to tolerate, then take it after lunch or dinner. Now this information will enhance compliance. How long will I take this medicine? As long as your hemoglobin comes to normal level, but you must continue tablet further for about 3 to 4 months thereafter to get the iron deposited in body stores which are exhausted at present because body has already utilized the stores to keep up with the hemoglobin extent. Not to the complete extent, of course. So it's the right drug information. Why is my hemoglobin low? Because you have lost enough amount of blood in menstruation. You must consult a gynecologist also to exclude some disease or female organs. Although menstrual disturbance is corrected by thyroid medicine. So it is the right advice. I shall consult, now this is a conviction. I shall consult gynecologist next. So IMG says, now remember do's and don'ts. Second medicine is a different color and it is in aluminum blisters. Be cautious when you open it because a sharp edge of open foil could prick your finger skin. Thanks doctor, I shall be cautious. Sometimes iron tablets cause stomach upset, so try to take it after midday meal or at night after dinner. Occasionally your stools, feces may get brown discoloration, so do not be alarmed. You may have constipation also, so take salad and plenty of liquids. Is the right advice. Do you take any other medicine at present? Question. Answer is occasional antacid liquid for heartburns. Remember to stagger antacid for 2 hours after thyroid medicine. So it is again a relationship between two. Finally, one more question, doctor. Where can I get these medicines? There are generic stores that supply medicines at an affordable price, but ask pharmacists to supply same formulation from same company every time. I think this is very relevant so far as bioavailability of the thyroxine is concerned. Is it so important? Yes. Thyroid medicines, particularly differences in manufacturing processes, change availability of the active medicine to body, leading to failure of treatment. How do I store these medicines? Both can be stored at room temperature, but don't keep them over top of the refrigerator or oven or under direct sunlight. Do not keep thyroid tablets bottles in the glove box if you are traveling. You must learn to open a child food bottle. Ensure that bottle cap is snugly closed lest moisture enters into air. Thyroid tablets are supplied in amber bottles because the activity is reduced when exposed to light and moisture. In all these cases, due information given to patient for appropriate drug use, and I am sure patient's autonomy is also preserved in decision making. And this is clear. She says, "Thank you so much. I shall take medicines as per your advice. Good day." Is that an effective communication can make major differences in therapy. So key points can be understood. First understand and then be understood. Then while communication, avoid close-ended questions. Yes or no should not be the answer. There should be some description. And also be polite in speaking. Tone makes the music. Avoid medical jargon. Use language patient can understand. Active listening is the most important. Controlling emotions and being non-judgmental. One of the judgmental issues is halo effect. With one attribute we judge the entire patient. That should never be done. And always get the feedback so that effective communication is enjoyed. We cannot always oblige, but we can always speak obligingly. So a good physician treats the disease. Great physician treats the patient who has the disease, as Sir William Osler said. Thank you very much for this discussion. Good day.